practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show for Tuesday, May 5th, 2020. We're going to get right into it. It's been a little while, but you may recognize his voice. He's been on the show a few times. Over there he is on screen, too. It's Ed Salazar, Edward J. Salazar. He's a respiratory therapist as well as wears a lot of different hats during his career. So, without further ado, I want to welcome to the program Ed. How are you doing this evening?
I'm doing real well, Dave. Thank you very much for having me back.
And thank you for joining us. And on the VMix here, this is going really well. So I'm so happy we can do this as we're still social distancing. I always share with everyone I'm on my 7th week here, but I'm doing the best I can to kind of, I guess, flatten the curve. So this is truly going to be a great library resource for us in our show library, because you're a respiratory therapist and you've been one for over 4 decades, correct?
Yep, 45 years, I'm not exactly sure.
Yeah, so you've seen a lot in that field. Yeah, and it's changed a lot. So I kind of want to go over a couple of the main ailments that can, affect the respiratory system. Obviously, we only have 30 minutes, so I'm kind of ask you a little bit about them on the fly. Starting with asthma, because asthma has been mentioned a lot during this pandemic. Tell us a little bit about asthma and why it, is an underlying condition, I guess, is the way I'd explain in the general public.
Well, asthma makes your lungs very vulnerable. You can be subject to narrowing of the airways from 2 different means. There's intrinsic asthma, which is caused by something within your own system, and then extrinsic asthma or allergic asthma, where exterior factors are what cause the effects of the asthma. Excuse me, sir.
Yeah, and that I know it affects the airways and a lot. Everyone's tuning into what's going on as we're figuring this thing out. But obviously, it's an ailment that I'm going to butcher this word, but exaggerates the issue there. I knew I wouldn't get that one right. You sound great, Ed, but I'm all over the place already.
It does exacerbate the problem. Yes. So that narrowing of the airways is caused by your airways actually have muscle fiber, bands of muscle around them. And when these muscles tighten or constrict, that's what causes bronchospasm or narrowing of the airways. That's when you start hearing these kids start wheezing, wheezing real bad, because you've got that air at a higher flow trying to go through a narrower opening, right? So, that's what's going to happen.
One of the main, well, you're an expert in this, and this is something that's grown in the last few years is COPD, or chronic obstructive pulmonary disease. And I know we're going to get into the IPV treatments a little later in the program. But briefly, tell us about COPD as well, and how that affects the lungs.
Well, COPD stands for chronic obstructive pulmonary disease. So it's chronic and it's obstructive. What obstructive is an accumulation of secretions in the airway. Again, the integrity of your airways is compromised. It can be environmental factors, smoking. There are even some forms of genetically acquired conditions that could be put in there with chronic lung disease, chronic obstructive lung disease. Most people know about, I'm sorry, go ahead.
No, go ahead. I didn't mean to interrupt you. Most people know about, you were saying.
I know there's time lag here. It's, a lot of people have heard about bronchitis and emphysema. Both of them are chronic obstructive pulmonary diseases. And, very often there are people that have a mixture of the two. They have components of both conditions. The chronic, as the name implies, it's a chronic situation where the bronchioles are inflamed. And the problem with the inflammation is that it doesn't inflame on the outside of the airway. It inflames on the inside of the airway. So the consequence of that will be, again, a narrowing of the airway. Increased resistance to breathing, and causing all the complicated, mucus retention and things like that. Now that's like bronchitis. Emphysema is a little different in that emphysema is the result of a rupturing of all air sacs in the lungs. They're called alveoli, and they appear, like these little clusters, And if a cluster of, let's make the math easy, 10 alveoli, the total surface area of each alveoli, it's a lot of surface area, and this is what allows for the gas exchange, so that oxygen can go lungs into the bloodstream, and CO2 can come from the bloodstream into the lungs. All that surface area, because all that surface area is covered with capillaries, which bring the good gas and take out, right? So in emphysema, you get a rupturing of some of those airways. The inner walls will start rupturing, so that you end up with a big balloon. These are called blebs, and the consequence of these blebs are twofold. They reduce your total surface area, so they decrease the gas exchange. In other words, the release of carbon dioxide and the onboarding of oxygen. This gets compromised. The other problem is that very often make these patients susceptible to pneumothorax. And if some of your viewers may have heard that term, but it basically just means air gets into the chest wall where it's not supposed to be, and causes a collapse of the lung. When people with severe edema, just sometimes can create enough pressure there to cause a rupture in one of their bleb in there.
Let me ask you, because we always think of emphysema as, caused by smoking. Can it be caused by environmental factors as well? Like you were mentioning, COPD can be caused by environmental factors. I even read a testimonial once. I always share this. I knew a man who was a sandblaster for painting, and he had developed COPD from breathing in, obviously, the particles that he was using to blast, masonry or whatever needed to be painted. So same with emphysema. Can it be caused from an environmental factor, not just smoking?
Oh, absolutely. Any irritation that is going to cause that inflammation down there, then you start getting eruption of the airways. we most often associate it with cigarette smoking, because it obviously is very, very prevalent in cigarette smoking. But yeah, environmental factors. Um, there's even a disease called alpha trypsin 1 deficiency, and what that is an enzyme disorder that some people are born with, and it manifests the same pathology and the same symptoms as emphysema. So you can call it a genetically acquired emphysema.
Oh wow! We always learn something on this program. That's what I love about doing the show. That is really neat to learn, because 10 minutes ago I didn't know about any of that, and neither did our listeners or viewers. Again, we're here with Ed Salazar. He's a respiratory therapist. He's got a lot of other credentials here that I'd probably butcher, but we've shared them before. I want to get into the IPV treatment, which we're going to do on the other side, but I want to take a quick commercial. Ed, if you can just stick around, and on the other side, we'll talk about this IPV treatment that you and your company, you lead a pulmonary hygiene team that helps people with COPD on the Living a Longer and Healthier show.
Okay. Looking forward to it.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back. And thank you, everyone, for tuning in. I see we got some viewers on Facebook, and we're on the radio airwaves as well. We're doing this via video, so doing our part to social distance. And Ed, you sound and look great. Again, it's Ed Salazar. He's an RRT, CPFT, RPSGT with All County Healthcare. And right before the break, I was telling you that Ed leads a pulmonary hygiene team. They offer conventional treatments such as, airway clearance therapy. And one of those treatments, we actually in studio, it's hard to believe it was a couple years ago, but Ed brought this machine. They're the only ones that are FDA approved, and I think the only one still using it in Florida, and you'll have to correct me if I'm wrong, but it's IVP therapy. Tell us about it, because I got to experience it firsthand, and I could feel the percussiveness, how it would break up the issues there inside the chest.
Well, IPV stands for intrapulmonary percussive ventilation. And the idea is, a lot of people know that if someone's, in the old school, you would clap them on the back, clap them on the back to help them breathe deeper, to help them cough, secretions up. But what IPV does, instead of giving that percussion externally, it actually gives it internally. What we've got is a nebulizer, like a lot of your audience might be familiar with Um, they have this nebulizer, and it's attached to the IPV machine, the intrapulmonary percussive ventilation machine, and it is designed to. It's got a. It's called a clutching mechanism. You have these high boluses of air coming in, and what it results in is that internally the patient is feeling this type of percussion, but they're feeling it on their the inside of their airways rather than the outside of their chest. I always tell people the good Lord gave us ribs to protect our chest. Intuitively, doesn't it make more sense to deliver those percussion inside, internally, instead of externally? And it does work. It's a very, very effective therapy. The technology, there's nothing new about this. When I was a therapist, back in the days when I was still, working in intensive care and such, and especially in the needle nail areas, high frequency ventilation was pretty well known. For whatever reason, it just kind of went out of favor, and then started making a renaissance. And the people who developed the technology, Percussion Air Corporation, Sandpoint, Idaho, they thought, well, if this type of technology is very, very effective in the lungs, why would it not be just as effective in lower acuity lungs? So that's how it progressed to become a technology that was found to be very, very effective with COPD and cystic fibrosis and things like that.
And your company, if people contact them, can work with patients that would qualify for this type of care. And I guess is it left at the patient's house then, the actual machine for treatments?
Well, the protocol we've used, and the one that is the most cost efficient, is that we have a nurse that is part of our pulmonary hygiene team. Now, these are nurses that I've trained myself, and we are extremely confident that these nurses can give very safe and very effective therapy to the patient in the comfort of their own home. So each patient gets their own personal circuit. The nebulizer, the mouthpiece, everything. That stays with that patient, and it's cleaned between each use. The nurse brings the device to deliver the IPV to the patient's home. And in these days, with things being what they are, the nurses take extra measures to use personal protective equipment, PPE, and the thorough cleaning and disinfecting of the IPV device before and after the treatment is given to the patient. So the nurse comes into the home. She uses the patient's own circuit, connects it to the machine, puts the medication in the nebulizer, and for a minimum of 15, preferably 20 minutes, the patient is going to be breathing through this mouthpiece. The nurse has been taught to modulate the amplitude, which just really means she's been trained to control the depth of the percussion with the device, and what she's looking for is the combination of frequency and amplitude that will give the patient the best therapeutic effect and still be comfortable. We emphasize that very, very much. If you do anything that makes the patient uncomfortable, there's no way you're going to give the good therapy. So you find a balance between what seems to be effective and what the patient is comfortable with. And we've been very, very successful with a lot of COPD patients.
Is it only used for COPD or can it be used for other ailments?
No, we have people in South Florida who use it for Duchenne's muscular dystrophy, MS, multiple sclerosis. There are a lot of neurologic diseases that result in the loss of muscle function and loss of muscle mass. And especially when these muscle areas have anything to do with muscles of respiration, the diaphragm being the big one, and certain accessory muscles that we have around our thorax. Um, in cases where this muscle mass is what's involved, then naturally the patient's going to have a progressively more difficult time just trying to draw a breath, and many times these types of interventions are very helpful and improve their quality of life.
Ed, you mentioned the nurse brings the IPV therapy right to the house, the actual machines. And it's Nurses Week right now, and I know you have a lot of nurses working with you, and and respiratory therapists as well. And I just want to thank all the nurses, and it's their week. We always observe it, but respiratory therapists as well, healthcare. Because definitely they are the heroes. First responders. We're definitely learning a lot about, the people who take care of us on a daily basis. It's their job, and they're doing a great job of it. So I just wanted to mention that. The other thing I was thinking, so this IPV therapy, it's brought to the house by the nurse. You told us how the mouthpiece is very sanitary. It's your team is highly experienced and trained. Now, how often does this type of treatment go on? I know each case is different, but I've read with COPD things. You can get them to like a baseline with treatment. So is this something that is done on like every few days, a daily basis for a certain amount of time?
Well, the way our protocol, the one we've been using that we've had the most success with, the nurse will see the patient every day for about 7 days. Then they will see the patient every other day or on a PRN basis. They'll call the patient, see how they're doing, see how they're feeling. And then 2 to 3 weeks after the patient has initiated therapy, they go back to their physician to be reevaluated. He can then determine, the efficacy of the therapy, if there was a positive effect, and he can decide whether or not he would like the patient to go through another cycle of the protocol if deemed necessary. Does that answer the question?
Yeah, and I knew it would be on a case-by-case basis, like most things are. I just was wondering if it needed to be done every day for a certain amount of time or every other day. But like you said, it's going to matter on, your team and how they evaluate, and then going back to the physician, which I know your company works with a ton of physicians for like 25 to 30 years. I may be a little off there. I know it's near 3 decades. So definitely have the experience. We only have a couple more minutes, so I wanted to mention to everyone on the website as well, there are a lot of COPD case studies, and I find your website as a resource. There's a ton of info on there, but that is really neat. Those case studies, I've been on there a lot, and then this week I really got into reading them. So thanks for putting those up there and sharing that as well, because COPD a couple years ago, I just remember knowing about it as the commercial with the elephant on the chest. But as you read it and as it's growing as an ailment, it's important to know what's going on with it.
Well, thank you very much. It's a joy to being here.
Well, thank you. Yeah, I hear the music come on. It's hard to believe we ripped through a half hour. That's why I knew I would only get through half of what. But I want to thank you again. You've been a friend of this program for, 4 to 5 years now, at least. So thanks for, explaining lung-borne diseases and treatments to us always.
My pleasure.
All right, Stacy.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on